The Free State now has lost a life to cholera as the outbreak raises serious concern. But to bring us the latest, we're now joined by the Free State Health spokesperson, Mr. Mondli Mvambi. Mr. Mvambi, a good morning to you. Thank you so much for giving us time here on the agenda.
Personally, good morning and to the viewers of SABC.
Yeah, I think let's start off with the case that we know of already where we have lost a life. What do we know about the death reported?
Well, a 33-year-old female was admitted to our Paris hospital. The person is a resident of Friede. The person was tested and, showing signs of cholera, and the results came out positive. And they demise, unfortunately, at our Paris hospital. It's a sad situation because we thought we were doing our level best as the province to cap the situation, but unfortunately, diseases such as this, they are quite fatal, especially when they, normally people don't die of a particular, bacteria that afflicts their body. They are. We are people with comorbidities, and at some stage they take these opportunistic illnesses. They take advantage of that, and they end up causing harm quickly to people. But we are satisfied so far that there's measures put in place. We are doing our level best really to keep the numbers low and. Excuse me.
Yeah, I think you can confirm what those numbers look like at the moment in the Free State, because one thing we've learned over the past few days, certainly at looking at the situation, even in Gauteng, is that the numbers change quite quickly. So you can talk to us about the cases that you have. But as you finish that, I think for residents of Vredehoek, for instance, and even Paris that are listening, they might very well be terrified. So talk to us about what the symptoms are to look out for, when to seek medical help.
Well, seek medical help as urgently as you can, and many of the people there have been visiting our clinics. We have about 8 people now that have tested positive to cholera, and this 9th person unfortunately has passed away. The 8, initially 6, were treated successfully in our health facilities, and the 2 others were also successfully treated and discharged home. We are intensifying health education, as I've said, but we ask people, whenever you feel any untoward symptoms such as nausea, vomiting, and loose stool, please visit your health facility and seek help as urgently as possible.
Health facilities, are they ready to deal with the numbers that might very well be coming in as we continue to see the challenges that are being grappled with the quality of water?
Well, we've opened our facilities, and we're happy so far that Paris Hospital, the clinics in Vredevoort, the clinics in Paris, the hospital in Paris, the hospital in Boitumelo, Kroonstad, have been able to work together very closely to make sure that people are seen as emergency cases and they are treated as quickly as possible. But you can never, with any outbreak, you can never guarantee the capacity of the health system, which we've built over the years as we're faced with COVID-19. We have been able to bring back those expertise that we amassed during the COVID-19 era to make sure that we beef up our systems to be able to respond to any outbreak, and we are doing exactly that right now. And it's proving to be working so far.
Yeah, so we've dealt with the issues of what happens once one is infected or suspects that they have essentially caught cholera, the bacteria. But let's talk a little bit about prevention. You've talked about the health education rollout that I suppose the Department of Health in the Free State is really working on. For a lot of communities in the Free State, they're grappling even with load shedding, right? So when we say, well, boil the water that you've got, for a lot of them that might be incredibly difficult. But Take us through the list of what people can be doing to protect themselves.
It's a big ask indeed, because you've got multiple pandemics running at the same time. Load shedding on its own, it's a pandemic. But we ask people to the best of their ability, because this is not a matter of choice. It's a matter of life and death. We are asking them, please boil the water and apply about 5 milliliter bleach to 20 to 25 liters of your water. Prepare food safely. Don't drink any water that comes from sources that you do not know. But even if you know the sources, like your underground water, your JoJo tanks, boil the water still, just to make sure that there's higher levels of integrity. Even those that are drinking water from the taps, let that water be boiled and apply the safe measures. We're asking people. It may sound simple. It may sound very little to do, but wash your hands with soap on a regular basis with treated water, so that there's you don't get yourself infected from the water that is supposed to save you. So treat that water and use that water to wash your hands with soap. Keep the toilets clean, and whenever people are afflicted by any suspected cholera touch, let them keep hydrated. Use about 8 teaspoons of sugar to half a spoon of salt in a 1 liter water bottle that is treated, that is boiled as well. So just to keep hydrated up until you seek urgent medical help. We are emphasizing this, and we are in the community in both Paris and Vredefort and all the other towns of the Free State, because we are not only isolated our response to that area that is afflicted. We have raised the alarm bells to all districts in the province, just to make sure that everybody is safe, and we don't take anything for granted. We would rather prevent than to cure people. So risk communication and community engagement has been activated. Our outbreak response teams are out there to do the work to make sure that the Free Staters are safe at all times.
Yeah, Mr. Mvambi, thank you so much for your time. That there is Mr. Mondli Mvambi, the Free State Health Department spokesperson.